A transcatheter closure device can assist in closing the aberrant holes in the heart. Now, the method usually it avoids an open heart surgery being conducted and is frequently used on both the infants and adults. Now, when significant paravalvular leaks, they complicate approximately 3 to 5% of the valve replacement, and transcatheter closure is thus emerging as a treatment. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I will be talking about a new rechristened rectangular Amplatzer PVL plug for transcatheter closure of mitral and aortic paravalvular leaks. In a recent study published in the Indian Heart Journal, researchers have tried a single-center experience of transcatheter closure of mitral and aortic paravalvular leaks using the new rechristened rectangular Amplatzer PVL plug. Among 79 transcatheter PVL closures in 8 years, 16 patients received the Amplatzer PVL plug. Crescentic shape on 3-dimensional echocardiogram was the inclusion criteria, while the exclusion criteria was the long axis dimension of the PVL exceeding 12 mm, non-availability of the appropriate sized plug in the shelf. Now, in the crescentic leaks, Amplatzer PVL plug varying from 8 to 4 mm to 14 to 5 mm was preferred. The plug was chosen 1.2 to 2 times larger than the traditional PVL and the device auto-oriented to the leak. The small 2 mm rim, it avoided any kind of a mechanical interference. Data collection, it included the symptom class, the cardiac rhythm, surgical details, type of prosthesis involved, the ventricular ejection fraction, the grade of pulmonary hypertension, blood tests for hemolysis and renal function. The residual PVL and valve function were evaluated on the echocardiography on 1, 6 and the 12-month follow-up period. 16 patients aged between 18 to 78 years who received a total of 18 AVP3 devices formed the study cohort. 8 plugs were implanted in the aortic and 10 plugs in the mitral position. 2 patients received 2 adjacent Amplatzer PVL plugs in the mitral position. Based on the analysis of the results, the research team concluded that the oblong-shaped Amplatzer PVL plug, it provided a much successful closure in the crescentic mitral and aortic PVL procedure. So according to the authors, the study does add to the fact that a rectangular, recently rechristened Amplatzer PVL plug, it adds to the armamentarium for crescentic leaks along the circumference. Auto-orientation of the plug and minimal protrusion are hence considered to be favorable attributes. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.